One, pause.
Hello, everyone, and thank you so much for joining us. My name is Dr. Hinton, and I am the founder and owner of Hinton Integrative Medicine. Today, we're going to be talking about 5 natural ways to manage your hypertension or high blood pressure and our ways to prevent it. We have a special guest today, Dr. Banam. Dr. Banan is very intelligent doctor. He's been practicing for over 40 years now. I'm excited to have studied under him, and we have some exciting information for you all today. So, should we get started, Dr. Banan?
Yeah, I think the first thing that needs to be said is that this is a very important topic because we're talking about high blood pressure, known medically as hypertension, and it is one of the leading preventable causes of death. It's one of the leads to conditions which are life-threatening, but it can be diagnosed easily, it can be managed, and these consequences can be prevented. Now, for a long time, it was believed that high blood pressure was not a health problem. It used to be called benign essential hypertension, and it was thought that it was, as you got older, it was just normal for you to develop higher and higher blood pressure. But then in 1948, a study was conducted with 5,200 people trying to figure out what was causing people to develop heart disease, what was causing people to have heart attacks. So they followed them over time, and they found 3 culprits: cigarette smoking, cholesterol, and blood pressure. So it soon became apparent that high blood pressure was not benign, that it did cause problems, that it did lead to health problems, but not only heart disease. It also led to kidney failure. It could lead to strokes. In some instances, it could even lead to blindness.
Right.
So the point is that we started to realize that high blood pressure was a major risk factor for other conditions. But one of the things that makes high blood pressure so dangerous is because in most cases you cannot feel it. You can be walking around for decades with your blood pressure elevated and not know. That's why they call it the silent killer. Some people can feel it. The people with extremely elevated blood pressure, they will be able to feel that they may be having headaches or they may be having chest pain, but in most instances, the only time that a person finds out that they have high blood pressure is if they have a heart attack or if they have a stroke or they're not feeling well and they go to the doctor and find that their kidneys are failing. So the point is that this is something that needs to be picked up, it needs to be diagnosed, it needs to be recognized, and it needs to be managed. Now, if something doesn't hurt, if you can't feel high blood pressure, how can it be causing so much damage? And the answer is that when the heart is working normally, it's just pushing blood through the system when the pressure is normal. But when the pressure is high, it's slamming blood through the system. So it's the difference between being tapped and being smacked. So it's smacking blood through the system. And the issue about that is that your heart beats. If your heart beats 80 beats a minute, that's 115,000 times a day. So all those smacks are adding up, and they're causing scarring in the kidneys. They're causing hardening in the arteries. They're causing all kinds of consequences to develop. But again, you may not feel it. You may not know that anything is going on, and that's what makes high blood pressure so insidious. Now, one of the things that needs to be discussed is the demographics of high blood pressure because African Americans have the highest rate. It's been estimated that about 45% of African Americans will suffer from high blood pressure at some point in their lives, as opposed to 32% of whites and 30% of Latinos, Hispanics. Now, one of the things about it, and the thing about it is that while high blood pressure is usually associated with age, it can occur even in the teens, the 20s, and the 30s. So while it's less likely to have high blood pressure when you're young, you're not immune to it. But again, you can't feel it, so the only way to find it is to measure it.
So let me piggyback on that. So say for instance we see people who are maybe not obese, but they are smaller, and a lot of those people think they are not at risk for hypertension. So we can let them know that that's not true because with hypertension you can be bigger or smaller, even though it is a greater risk when they're obese. You want to talk a little bit about that?
Exactly. Yeah, obesity is one of the risk factors for hypertension. And there are other factors as well, and such as diet, lifestyle, heredity, what's in your family, have your parents had hypertension, have relatives had it? There are a number of risk factors, some many of which we can change.
Mhm. Yes, absolutely. So, for you all out there wondering, what is hypertension or what is high blood pressure? So, high blood pressure or hypertension is basically a high sustained number over a period of time. So, if you get your blood pressure checked and it's high, is not to be of concern if maybe you just went for a run, you've had a stressful day, or something else is going on. You want to have more than one reading, and that number has to be consistently high over time. And when we talk about the numbers are 140 on the top or greater, or 90 or greater on the bottom. And as Dr. Bernard, he made a good point about it being a silent killer and not everybody having these symptoms. Most times you don't. And so we see some of the signs that he talks about with the chest pain and the severe headaches with people who may have blood pressures that are 180 over 120 is where some people may find that they have those symptoms. But again, even in that, those people, that may not be the case as well. So it is a serious condition and it definitely has to be managed. So Dr. Bernard, let's talk about a little bit more about the risk factors. Now you
Okay.
said obesity, alcohol. Would you
Hmm.
agree? Alcohol, also like sedentary lifestyle, eating a high salt diet are all risk factors. Smoking, even contributing a low potassium diet, all contribute in risk factors for hypertension. Is there any others that you like to add?
Well, a couple of points I want to make here is that why do we measure blood pressure in two numbers? Well, the top number, which is the bigger number, is when the heart is squeezing, so there's more pressure in the system. The lower number is when the heart is relaxing,
Mhm.
when it's filling up.
Mhm.
So when it's filling up, the pressure in the system drops down. Either or both of the numbers can be elevated, and if either one is elevated, it is a concern.
Absolutely. So,
And one more point, please. Hypertension begets hypertension. If your blood pressure is high, it's damaging your system. It's making your arteries stiffer. It's causing problems with your kidneys. Kidneys regulate blood pressure. So anything you might start out with a mild case of hypertension or high blood pressure, but left to itself, it will tend to become worse and worse and worse. So a lot of the people who did present with the chest pain or the headaches or something of that nature because their blood pressure was very high, like 180 over 120. If we had gotten to them years earlier, it wouldn't have been that bad. It might have been high, but it would not have been that high as to cause symptoms.
more manageable. So that takes us to another point, management. What are ways that they can manage that blood pressure? So first of all, lifestyle changes, making sure you're managing your stress properly, exercising 3 to 4 times a week, about 30 to 45 minutes. I know some people, they're not used to exercising. Maybe they live a sedentary lifestyle or a lifestyle where they maybe sit at a desk all day or maybe sit on the couch all day. But for those people, they can get started. They can get started doing 5 or 10 minutes a day and work their way up to that 30 to 45 minutes 3 to 4 times a week. And so when we talk about exercising, we talk about exercising in a point where you want cardiovascular workouts to be your priority. So whether that's swimming or dancing or jogging or running or tennis, you want that heart rate up for a certain amount of time, and that is going to help with your blood pressure over time. Also, stress management. Some people may practice yoga or relaxation. Those things are important as well so that it can help you to relax. But in addition to that, I know for some people who have hypertension, maybe they didn't know about these things and maybe they went to their doctors and because their blood pressure was not managed, they were put on blood pressure medication. Well, maybe they don't want to be on blood pressure medication. But let's talk a little bit briefly about the main categories of blood pressure that we see in practice
Yeah, with blood pressure medications, there are three main classes. One is diuretics. They cause greater urine output. A second one is what they call calcium channel blockers. They put calcium causes the blood vessels to contract, and they block that. And the third one is what they call ACE inhibitors or ARB, which basically there's a hormone in the body that causes blood vessels to constrict called angiotensin. The ACE inhibitors prevent the production of angiotensin, and the ARBs block the receptor where the angiotensin would arrive. Now, these medications are good first line medications, but the choice of if a medication is to be used, the choice has to weigh some aspects of your lifestyle. For instance, I had a relative who was a runner, and she had high blood pressure, and she was on a diuretic. And after a run, she felt dizzy, and she was sitting down and was instructed not to stand up. But she tried to stand up, and she collapsed. What had happened was the diuretic took a lot of the water out of her body, and then when she was sweating, she just lost too much water, and the enough blood wasn't reaching her brain. So somebody who's very athletic, a water pill might not be the best choice. But for some other people, it may be a great choice. Then also the calcium channel blockers, they tend to work better with people of African descent. Now, not every African American is gonna respond well to a calcium channel blocker, but as a rule, generally, African Americans tend to respond well to that class of medication. The ACE inhibitors and the ARBs, they work very well for people who have kidney problems because they actually protect the kidneys, and they're also good for use in people who have some degree of heart disease. So your overall health condition and your lifestyle may influence the choice of what type of blood pressure medication you should be chosen on your behalf. But whether you use blood pressure medication or lifestyle or herbs and supplements or whatever you use to control your blood pressure, make sure you're monitoring it to be sure that that intervention is working. In my own family, I have a cousin who had elevated blood pressure, and she decided to manage it without medications, with just herbs. But she didn't monitor it. She didn't see, is this actually working? And she ended up losing her kidneys and being on a dialysis machine.
So basically, what you're saying is that alternatives are very helpful, but they need to make sure that they're doing their portion, right?
Yeah.
They need to make sure that they're eating right, they're exercising, they're doing what they need to do, and also making sure that they're getting that check. So,
Well, whether you're on medications or whether you're using a lifestyle or whether you're using herbs and supplements, make sure it's working. Even if you're on medication, that's no guarantee it's going to work. If you're on that type of thing, whatever you're using, make sure it gets the results that you want to get. That's the main thing. If you have a history of high blood pressure, monitoring your blood pressure is essential to make sure that it's getting better or it's not getting worse. And that's one of the things. And if you are on blood pressure medication, if you decide to do something different, like to go to more natural ways, make sure that whatever you change to is working. We don't encourage people to get off medications that are working for them. A lot of the people who modify their lifestyle, a lot of the people who modify their diet, who modify their exercise and things, sometimes they can get by with less medication or get off medication completely. Sometimes that happens, but don't just get off and try something different.
yeah, so we definitely want people, if they are on medication, to gradually come off of them, but we want them to make sure that we're implementing some of these other things into their lifestyle, like changing the way they eat, making sure they're not sitting down all day or for long periods of time, making sure they're managing their stress. So a little bit about, we're going to kind of switch to more of like herbs and supplements. Let's talk a little bit about that and how those are useful in managing blood pressure.
Hmm. Yeah, there are a number of herbs and supplements that can work. There's a Northern European herb called hawthorn that appears to lower blood pressure. It's been used for centuries as a heart disease medication in Europe, and it does appear to have beneficial effects on blood pressure. It has a relatively mild effect, so I wouldn't consider it in somebody who has severe high blood pressure, but the point is that it can be useful. That's one of the things. That's one of the herbal medications that can be useful. Another thing we can consider it an herb, even though it's a food, is garlic. And garlic tends to lower inflammation in the body. It's a mild blood thinner,
Yep.
and also it tends to lower blood pressure. Tends to make the blood vessels relax. There is special version of garlic called kyolic garlic, which is basically aged at room temperature for something like at least 20 months. That appears to be especially effective in regulating blood pressure. So that's one of the herbs that may be tried. Another thing is omega 3. Omega 3 stabilize membranes. They tend to be good for stabilizing the heart. A lot of the brain is made up of a lot of omega 3s. I think it's something like 20%. So omega 3s have a tendency to basically reduce inflammation and to lower blood pressure and to relax blood vessels. So a supplement with omega 3s may be able to help.
They're really good for the heart as
Uh-huh.
well. Very heart healthy. What about magnesium?
Magnesium. Okay, one of the things that constricts blood vessels is calcium. Remember we talked about the drugs that were calcium channel blockers? So if you got calcium in the system, it tends to tense your blood vessels. Now you need calcium. You can't live without it. But the point is that you want it to go to the right places in your body. Magnesium competes with calcium. So the point is magnesium has a strong relaxing effect on blood vessels.
And Dr. Bernard, let's talk about this as well. I know a lot of people, they take calcium, but they don't take vitamin D3 with it, which is very necessary to push the calcium into the bone and out of the blood.
Vitamin D3 and K2.
Yes.
K2. Now, this is one of the things, this is very important, especially for black people. About 40% of the people in North America are deficient in vitamin D and don't know it. And among black people, it's closer to 80%. The reason being that our skin is darker, so we need more sunlight to generate vitamin D. You ever heard vitamin D called a sunshine vitamin? Because your skin actually makes it. We call it a vitamin. Technically, it's a hormone, but it does a lot of things in the body. It reduces inflammation. It enhances the immune system. One of the things about vitamin D that was very striking was that they noted that during the COVID epidemic, during the COVID pandemic, people who had high levels of vitamin D were less likely to die from COVID. They were half as likely to die. The reason being that vitamin D makes the immune system function better, but it also makes the immune system more targeted. One of the things that was killing people in COVID was that the immune system went crazy. It generated so much inflammation and fighting in the lungs that it ended up destroying the lungs. It caused inflammation in the blood vessels that was causing blood clots. So COVID was killing people through inflammation. Vitamin D is anti-inflammatory. I suspect we would have less cases of high blood pressure in the African American community if we had adequate levels of vitamin D. But not only better blood pressure, I think we would have less cancer. A doctor, a urologist, did a study on men who had prostate cancer, and he found that a lot of them had little or no vitamin D in their system. So the point is, it may be a risk factor for prostate cancer, pancreatic cancer, lung cancer. Vitamin D is protective against a great many things, including high blood pressure. Vitamin D can help with that. And we have had people come to our clinic, and we're one of the few clinics that test for vitamin D, and finding that we find a lot of black people have very low levels. And so the point is that, but when you take vitamin D3 specifically, there are different versions. Vitamin D3, you should take vitamin K2 with it. Not K also, but K numeral 2, because vitamin D can raise the calcium in your system, but vitamin K2 directs it to the bone instead of the tissues. So vitamin K2 is important too. Another thing that is very important is coenzyme Q10. Coenzyme Q10 helps the heart muscle function. It generates energy for the heart. It works in a lot of different systems. Coenzyme Q10 reduces inflammation and it protects blood vessels and reduces hypertension.
And it's great for cholesterol as well, for those with high cholesterol. So tell us a little bit about folic acid.
Yeah, folic acid is an important thing. They were taking folic acid, generally with vitamin B6 and vitamin B12. They did an enormous study, a very big study, some of 20 different studies that totaled over 20,000 people. And they found that those that were on folic acid, especially with vitamin B6 and vitamin B12 in combination, it lowered both the high one, the systolic, where the heart is squeezing, and the diastolic, where the heart is relaxed, blood pressure. So it worked very well, that was in 20,000 people. That demonstrates that there's a real effect of folic acid in terms of reducing. But again, whatever intervention you take, whether it's herbal supplements, medication, lifestyle, monitor your blood pressure. Make sure that what you're doing is working.
Mm-hmm. And so that's a good point with monitoring. We know that not everyone has a doctor that they see on a regular basis. We feel that it's important that you do, but we know not everyone does for whatever reason they choose to. However, if you do not have a doctor that you are following, you can go to places like your local Walgreens or CVS. You can use those. Those give you a roundabout of what your blood pressure may be. Also, you can buy the actual kit itself and you can take your blood pressure at home. It's very easy. You have the wrist one and you also have the arms where they're automatic. But a couple things to consider is that you want to make sure that you have both of your feet flat on the floor. You want to make sure that you are not coming in from a recent activity and that you're sitting for about 5 or 10 minutes, you're relaxing, and that your arm, when you check your blood pressure, that is at the heart level, that it's not way up here or not way down here because you're going to get false readings that way. So again, making sure your arm is at heart level when you're checking it, your feet are flat on the floor, and making sure that you have been relaxing for at least 5 or 10 minutes before taking blood pressure. We encourage that you take it in both arms just to see the difference between the two, so you can get a better accurate reading. Dr. Fanon, anything else you'd like to add?
You want to show them how it's done?
Absolutely, I think we should.
You got your gear?
I have my gear.
Well, when you got your gear, you got game. So let's go.
All right, so we are going to demonstrate. Now, the ones that you buy in the store doesn't usually call for a stethoscope, but for this, when you're doing it manually, this calls for a stethoscope, and this is one of the most accurate ones is checking with the stethoscope. But because most of them do not have the stethoscope to go to it, what I'm going to do is just demonstrate the blood pressure part of it, and then I'll kind of go through with you the buttons you'll mash, and then allow it to do its thing on its own. So first things first, you'll have a little cup that'll look something like this, okay? Down here at the bottom, you'll see two arrows. One says left, one says right arm. You want to make sure that you line those arrows up with the middle part of your arm, which is right here in this area. So if you're using the right arm, you want to make sure that the right arm goes in the right place. If you're using the left arm, you'll look for the arrow with the left arm. And you want to make sure that you get that in the right place, because if you don't, then you won't have an accurate blood pressure. Okay. So the second thing is you want to make sure that this is snug but not too tight. So you want it to be snug but not too tight. And so you should be able to stick two fingers underneath here without it being very snug. That means that it's not too tight, but it's tight enough. Okay. After that, you'll have a button on the device that you'll hit start. You want to make sure your feet are flat on the floor. You want to make sure that you're sitting properly. You want to make sure that your arm is the level of your heart, not up here, not down here. Dr. Badon, what happens if your arm falls here?
Then gravity is going to pull blood into your arm and raise the pressure.
Absolutely. What if it's up here?
It's going to pull blood away from your arm and lower the pressure.
Absolutely. So it's not going to be accurate. So we want it at heart level, okay? So now that his feet are flat on the floor, he's been sitting for a while, his arm is at the level of the heart, we'll go ahead, we're going to hit start, and we're just going to relax. So once you hit the start button, make sure you don't move, you don't talk, you don't cough, or any of that, because any of those little nuggets will cause an increase in the blood pressure because of movement. You'll sit still until that stops. Once that stops, you will get a reading, a top number and a bottom number. The top number is what we call systolic, that's the contraction, and the bottom number is what we call diastolic, which is the relaxation. And together, that gives you your blood pressure reading. So again, as we talked about earlier, you should not have a blood pressure that is reading over 140, and you should not have a blood pressure on the bottom that's reading on over 90. And of course, you can't do that by just one reading. You want to do that over two or three readings because it's the consistency of the blood pressure being high that states that you're hypertensive. Thank you, Dr. Banan, for letting me use your arm. Yes.
One other thing, blood pressure varies with position. When you're standing, blood goes down in your legs, so your blood pressure is lower. When you're laying on your back, blood flows into your system, so your blood pressure is going to be higher. So blood pressure varies with position.
Absolutely. And another important part is it also varies when you're hydrated or not hydrated. I know today's topic is on hypertension or high blood pressure, but also it is so important, especially in the summer with it being so hot, to stay hydrated because when you don't have enough water intake, your blood pressure can drop and then you can pass out. So that's an important factor too of how that is affecting the blood pressure, even though it's making it lower, it's still causing an effect on the blood pressure.
And it can vary temporarily with your emotional state. There used to be a fictional character who used to get angry and upset all the time. And his first name was Buster and his last name was Blood Vessel. So his name was Mr. Buster Blood Vessel. So don't measure when you're upset.
Absolutely. So, you all, I just want to recap on what we talked about today. We talked about what hypertension is. We gave you techniques and different management skills on how to go about managing that, such as lifestyle changing, the way you eat, exercising, stress management, different herbs and supplements that you can take, and just making sure that you're taking overall good health care of yourself.
Can we add a little bit more about diet and be a little more specific?
Oh,
I would like to.
absolutely. Let's talk about those low sodium diets.
Not only low sodium, but we have a lot in our diet. We have insanely high levels of fats, oils, and sugars,
Absolutely.
and that's contributing to the overweight problem.
Absolutely.
When I was in medical school, one of the things they used to say, if you have one parent that's obese, your chances of being obese are 10%. If you have two parents, etc. We're seeing people who parents were never obese who are overweight, who are overweight now because our diet has very high levels of fat, with fats and oils, which have tremendous number of calories and sugars, and that's causing problems. I recently spoke to a physician, a doctor from Emory, and he said he's seeing more and more healthy old people and sick young people because our diet, it's too caloric, it has too many things, it has too much sodium, it has too much fat, it has too much salt.
So
Maintaining a healthy weight, maintaining a healthy weight prevents a lot of different problems. There's a condition called metabolic syndrome where if your belly is big, you tend to have high blood pressure, high cholesterol, inflammation, uh, and high blood sugar. So the point is that getting abdominal fat can be very dangerous. It's best to keep that as low as you can.
And a lot of that fat and sugars are coming from what we call carbs and high fatty meats, animal products such as dairy, things like that carry a lot of salt and fat. And so those are things that I try to encourage my patients to do away with or minimize them in general because these foods are causing our health to become bad because they are having an effect on us, whether they're teaching us this or not. Those foods are not healthy for us, and that's what's causing the high cholesterol, it's what's causing the hypertension, it's what's causing the diabetes. And we say, well, my mom had it or my grandma had it. No, you have it because you're doing the same routine as your mom and your grandmother. If you're eating the same, you're going to get the same results. So we have to change our eating. I like to focus on beans, grains, nuts, things like that, and try to kind of limit or do away with the animal
Mhm.
products and byproducts.
And that's right. And if your grandmother had it, Mom's Mabel used to say, if you always do what you always did and you always get what you always got.
That's true.
And the thing about it is, it's not enough. You know, some people say just a vegan diet. French fries and beer could be a vegan diet. You want unprocessed whole. You want your diet to consist of a lot of unprocessed whole
Right.
plant foods is the healthiest diet.
Absolutely. Like I was saying, those beans, grains, nuts, berries, things like that.
Absolutely,
Vegetables.
absolutely. That should be the majority of your diet.
Absolutely. Well, I would like to say thank you so much, you all, for taking the time to watch the show. We really hope that you learned something today about hypertension, how to manage and control that, and how, most importantly, how to prevent that. So we'll see you next time.
And cut. There you go.